Introduction to Workplace Safety and Health, WSH. Hazards and Risks. Overview. Workplace injuries and occupational diseases occur as a result of unsafe acts and unsafe conditions. Unsafe acts usually occurs when employees are unaware of hazards or the proper work practices. Unsafe conditions refer to hazardous physical conditions of the work environment and equipment. Workplace accidents and occupational illness can be prevented by recognizing the hazards associated with the task to be undertaken and taking the necessary prevention measures. What is hazard, risk and accident? Hazard is anything with the potential to cause bodily injury, including physical, chemical, biological, mechanical, electrical or ergonomic hazard. Risk is the likelihood that a hazard will cause a specific bodily injury to any person. Accident is any unintended event which causes bodily injury to a person, but does not include any bodily injury sustained by a person. Common workplace hazards. Physical hazard. Fall from height hazard. Ergonomic hazard. Electrical hazards. Fire hazard. Mechanical hazards. Chemical hazard. Biological hazard. Environmental hazard. Physical hazards. This includes slips, trips, cuts, and other physical injuries from uneven surfaces and cluttered work environments. These are the most common work-related hazards, and usually the least dangerous. Nevertheless, the possibility for more serious injuries is ever present and puts older and disabled members of your team at greater risk. Slips, trips and falls. Hazard. Wet or dirty floor. Uneven walking surfaces. Obstruction or protruding objects and walkways. Suggested safety tips. Keep floor and stains dry and clean. Use anti-slip mats. Wear non-slip shoes. Put signs to warn passers-by about slippery floor during and after cleaning of floor. Take prompt action to repair defects. Use highly visible tread markers to highlight changes in the level or slope. Keep work area neat. Provide adequate lighting. Make sure handrails are firmly fixed and stable. Install anti-slip strips at edge of each step. Struck by falling objects. Hazard. Overstacked or overloaded shelves. Reaching for objects stored on shelves where objects cannot be clearly seen. Standing or working underneath works being carried out at height. Suggested safety tips. Do not overload shelves and cabinets. Stack materials in stable manner. Store heavy or frequently used objects at lower shelves. Use step ladders to reach higher shelves. Barricades and signs to warn of overhead work. Struck against objects. Hazard. Bump into doors or glass panels. Bump into person or object, open doors or cabinet. Suggested safety tips. Mark glass door with colored or translucent tape. For commonly used door, insert a glass panel so that employees from both sides of the door can see each other. Ensure sufficient space to move around in the work area. Fall from height hazard. Falls from heights are among the most common and serious workplace injuries. Those working in construction and maintenance on roofs and raised spaces are most at risk. Falls from height. Hazard. Poor ladder condition, for example shaky or bent ladder. Carrying load while climbing up or down a ladder, no three-point contact. Suggested safety tips. Check ladders are in good condition before and after use. Use ladders on hard, even, non-slippery surfaces. Make sure the locks and braces are fixed and properly engaged before use. Face ladder when standing or climbing it. Always maintain three-point contact with the ladder. Any work activity that involves access to positions that cannot be reached when standing on the ground should be regarded as work at height. Ergonomic hazard. Sprains, body fatigue, and wear can accumulate over time due to repetitive tasks and awkward postures. This can result in chronic conditions that require physical therapy to correct. They can also have a drastic adverse effect. Manual handling. Hazard. Lifting heavy objects. Jerk to lift an object off the floor. Running with heavy object. Carrying objects by straps or tapes. Suggested safety tips. Get help from others when lifting heavy items. Plan your lift adequately. Position, center the body and feet correctly. Lift item using good posture. Proceed, move toward desired location. Place, set object down safely. Static posture. Hazard. Stand or sit for long hours. Suggested safety tips. Stretch or move about at workstations. Anti-fatigue mats. Ergonomic chairs. Provide employees with a place to rest, such as a pantry. Repetitive movements. Hazard. Using same joints and muscle groups over extended period. Suggested safety tips. Short regular breaks. Staff rotation. Warm up or cool down working muscle. Review loads and speed of work to be done. Electrical hazards. Shocks from live wires and malfunctioning equipment can happen with no warning and can easily be fatal. The urgency and danger of electrical hazards underline the importance of taking the appropriate preventive measures. Electrical hazards. Hazard. Defective equipment. Damaged electrical cords. Exposed wires. Overloaded circuits, plugs or extension cords. Wet/damp conditions. Suggested safety tips. No overloading. Remove defective appliances. Inspect and maintain electrical appliances and power cords. Keep power cords away from heat, water and oil. Use approved electrical appliances or plugs. Fire hazard. Poorly maintained electrical equipment can lead to fire, which can cause burns at varying degrees and even death. Fire is a hazard that can happen in almost any workplace, so fire extinguishers should be accessible and regularly maintained at all times. Fire hazards. Hazard. Overloading of power circuits. Misuse of electrical appliances. Poor housekeeping. Suggested safety tips. Ensure no overloading at electrical points. Follow electrical appliances recommendations and instructions. Establish emergency evacuation route of escape or emergency plan. Mechanical hazards. The potential for injury from improper use of work equipment, as well as the ever-present possibility of machine malfunction, can be serious and even life-threatening. All mechanical action motion is hazardous, but in varying degree. Mechanical hazards. Hazard. Rotating, reciprocating and transverse motions. In running nip points. Cutting actions. Punching, shearing and bending actions. Suggested safety tips. Enclosure guards. Interlocking guards. Automatic guards. Remote control, placement, feeding and ejecting. Chemical hazard. Exposed and poorly managed industrial chemicals like cleaning products, solvents, carbon monoxide, gasoline and more can lead to skin irritation, burns, eye injuries, and blindness. Chemical hazard. Hazard. Breathing in. Skin or eye absorption. Ingestion. Injection. Suggested safety tips. Store products in their original containers. Use chemical according to manufacturer's instruction and intention. Avoid mixing cleaning products. Wear protective equipment, PPE. Biological hazard. Biological risks can originate from agents that transmit illnesses to humans, such as insect bites, bodily fluids, bacteria, and viruses. The harmful effects are mainly of three types: infections, allergy and poisoning. Biological hazard. Hazard. Breathing in. Skin or eye absorption. Ingestion. Injection. Suggested safety tips. Use respiratory protection, mask. Wear protective clothing. Wear goggles or face shields. Use gloves. Use shoe cover. Sterilize regularly. Remember personal hygiene.
Environment hazard. Hearing damage or loss can occur from progressive and ongoing exposure to loud noises, such as from heavy machinery or other loud sounds. Poor air quality in the short term can cause irritation to the eyes, nose, throat, and lungs, as well as an increased risk of respiratory infection. Long-term exposure may lead to diseases including stroke, ischemic heart disease, chronic obstructive pulmonary disease (COPD) and lung cancer. Non-ionizing radiation can cause symptoms most commonly experienced include dermatological symptoms and fatigue, tiredness, concentration difficulties, dizziness, nausea, heart palpitation, and noise hazards. Hazard. People. Loud and frequent conversation. Equipment. Environment. Example. Air conditioning system, lifts. External sources. Suggested safety tips. Use meeting rooms for long and frequent conversation. Place equipment in a separate room. Design rooms with sound-absorbing materials where possible. Maintain equipment and machinery regularly. Place equipment or machinery further away. Use sound-absorbing materials to contain sound where possible. Install double-glazed, indoor air quality. Hazard: carbon dioxide, carbon monoxide, formaldehyde, ozone, volatile organic chemicals. Bacterial counts, fungal counts, suspended particulate matter, air temperature, humidity, and air movement. Suggested safety tips: deploy air cleaning devices to reduce particles and bacteria. Install ventilation or blower fans to improve airflow. Air conditioning work area. Fume extractor system to clean and redirect non-ionizing radiation. Hazard: telecommunication antennas, optical devices, Wi-Fi devices. Suggested safety tips: do not touch antennas. Stay out of the radiation zone of the antennas. Do not look into optical cables or connectors. Do not place devices or antenna lesser than the minimum distances between two devices or antennas as recommended by the
Thanks for watching. Like, share and subscribe.